everyone. Hello. My name's Anna Palmer. I'm the CEO and one of the founders of Punchbowl News. Thank you so much for joining us in person as well as on the live stream for this pop-up conversation with Senator Catherine Cortez Masto, the Democrat from Nevada. We're going to talk news of the day. No shortage of that. The Senate was in very late last night, but exciting news. The government will be funded. We are going to talk health insurance, the state of Medicare Advantage, and all sorts of other things in this conversation. A big thank you to AHIP for partnering with us to make this conversation possible. After my conversation with the senator, I am going to be joined by Sohini Gupta, EVP of Government Affairs and Innovations at AHIP, as well as Chairman Kevin Brady, which is fun to see a friend back in Washington. As always, you can find Punchbowl News on all social media at Punchbowl News. We encourage you to share about this conversation. And with that, I'm going to welcome the senator to the stage, Senator Cortez Masto. Welcome. Thank you so much. I'll have you here in the middle. Okay. All right. Well, as always, with these conversations, we start with a few news of the day questions. You were up late last night. First things first, Congress basically punted its problems 2 months, right? We kept the government funded. I think everybody's here is excited to go home for Thanksgiving. But how worried are you about a government shutdown come January?
Well, I know this. On the Senate side, the Republicans have already worked together. We passed out of committee our budgets. We've already done the first tranche of it in a bipartisan way. I'm ready to move the rest of it. I can't speak for the House. I will speak for the Senate, that we know how serious this is, and nobody wants to shut down the government. We shouldn't be shutting down the government. It's going to be devastating for Nevada. It's going to be devastating for so many across the country. So our goal should be always to keep it open and work together in a bipartisan way.
We were writing this morning in Punchbowl News AM about not just the issue of what's going to happen on government funding, but the kind of must pass and then want to pass bills that you're going to come back to, right? There's some unresolved issues here, whether you look at the Ukraine, Israel, Taiwan funding with the border security package. There's the NDAA we were talking about backstage, which is a bill that kind of always has gotten passed. Questions about whether that can get done, FAA. Talk, though, about the supplemental when it comes to this disaster and foreign aid relief. Do you think it's going to get done, or are Republicans kind of mucking it up when it comes to the border?
Well, let me speak on the Senate side again, because we already know where some folks, unfortunately, on the right wing that just want to say no to everything in the House. On the Senate side, there's bipartisan support for the entire package, right? We've already heard Senator Leader Schumer and McConnell basically say we want all of the above. And I do think it is important that we provide the support for all of the above, including, listen, I have been somebody that has been talking about the need for border security and really voting to fund border security since I've been in the Senate. Mm-hmm. Nevada is not a border state, but what happens at the border bleeds into Nevada. The fentanyl and the drug trafficking, the human trafficking, the weapons trafficking, when we're talking about immigration and illegal crossings, I mean, all of that is why we need to continue to fund and secure the border. The president has put $14 billion border security package for that, to address those issues. He just came from a meeting with President Xi talking about the need to address the fentanyl problem. We've passed out of the Banking Committee the Fend Off Fentanyl Act, right, in a bipartisan way. So this is something we need to address. And we can, but we should be working together to get it done. And so the supplemental, I believe, is important if we are going to be addressing border issues. We're going to look at funding Ukraine, funding Israel, Indo-Pacific, along with the humanitarian aid. I think it's all important.
All right, let's get to the topic at hand, healthcare, the healthcare system and insurance. I want to start with the Inflation Reduction Act. Can you talk about the impact that legislation had on the healthcare industry?
Oh, absolutely. Just in general, let me just say this as a Nevadan. I'm third generation. This is a state I know so well and love my state. It is a beautifully diverse population. It's about 3 million people. And I will say about 580,000 are seniors. That's about 18% of the population. They're paying attention, right? I know when I'm home and I'm talking to seniors, their concern is how do they cover their health care, how do they pay their bills, how do they keep a roof over their head, all of the above, right? So this idea about prescription drug negotiation really starts with the seniors. They know the impact it's going to have. So for us to be back in Washington to work in the Reduction Act to not only allow for that negotiation, to cap the cost of insulin, to cap out-of-pocket costs for them, to really show that we're fighting for our seniors and delivering for them was important. And I do think it's still important that we continue down that path to give seniors choices at the end of the day. That's what this is about for me. Finding this balance of how do we ensure our seniors have choices when it comes to, if we're talking healthcare, their healthcare. And make sure that and in that choice, it's affordable, there's quality healthcare, and they have access.
Right. Well, let's talk about that. Let's dig a little bit deeper on the insurance aspect of this. You're a member of the Senate Finance Committee. You've long been working on Medicare Advantage. Talk to us about what you hear from either your constituents or why you kind of see this as such an important part of that insurance mix as you were just talking about.
Yeah, no, Nevada is a perfect example of why there's this balance and why I believe why we need both. First of all, we need to make sure that Medicare is solvent. And then the next piece of this is how do we ensure we give our seniors choices, Medicare Advantage and traditional Medicare, because both of those are working in Nevada. There's 17 counties in Nevada. 14 of them are rural and frontier. And what I know getting around my state and talking to not just seniors, but healthcare providers is both are working. And seniors want those choices. Let me just give you an example. Battle Mountain is an acute care hospital. It's in a rural community, very small. Medicare Advantage won't work for them. And it's not very strong right now in that community. But traditional Medicare works to help keep that hospital open and provide essential services for those seniors. So, but I also know in our urban areas, and I'm talking to seniors, but also my own healthcare provider who talks to his clients that they like the option of Medicare Advantage. That works for them. So the goal is how do we make those choices available, but how do we keep Medicare solvent? And I will tell you, we just had a hearing in Senate Finance on this very issue. My challenge is to bring more transparency. Why? Because what I'm seeing in the numbers now is Medicare Advantage is costing more than the traditional, right, Medicare. And why is it costing more? Because that wasn't the intent. Right. As you and I were talking earlier, when it was created, that wasn't the intent of the Medicare Advantage. But why is it costing more? And how do we understand it so that we can actually keep those costs down, keep Medicare solvent, and continue to provide those choices to seniors?
You were part of a bipartisan group of senators who sent a letter to CMS earlier this year asking the agency to keep Medicare Advantage in mind and protect it during the rate notice period. What's the latest there? How confident are you that they're taking your concerns into mind when they're making these decisions?
Well, I'm never confident when we're talking to the administration on certain issues, but I will say this, they have been responsive. In the sense that they are on the phone with me, they are listening, and we've seen actually, I will tell you, with the CMS administrator, I've seen in response to my conversations, and many others, let me just say, advocacy matters, the impact, she's listening. They're listening and trying to do the right thing here. This is the challenge that we have on Capitol Hill, which is fascinating to me as well, because we have some Republicans who want to do away with traditional Medicare. And then I have some of my colleagues that don't like Medicare Advantage, right? So that is also playing out when the administration is listening to everyone and trying to address this issue. I think for me, it is important that, and I'm going to go back to data, I'm a data person. I think we need the data to tell the stories. And that's why, to me, the transparency in all of this, collecting that data to say what is happening is going to be key for us to keep these choices and that solvency moving forward.
Wanted to get your reaction to the Biden administration and CMS draft rule that came out, basically saying that Medicare Advantage needs to work harder to encourage customers to take advantage of those extra benefits versus just having them as a selling point. Do you think that that's appropriate? Are they kind of, are there other issues that you would want to see as part of that draft rule?
Well, let me just say this. I can tell you there's so much to this. I will say this, for purposes of Medicare Advantage, and I'm a big fan of it and I'm a supporter of it, but I also know, one, we need that more transparency, but two, we just had a hearing on this, and even in my own office, I had one of my employees trying to work with his mother to get information about, and there's misinformation. There's deceptive marketing happening around a Medicare Advantage by third parties, and we've got to address that as well. That is a concern of mine. I think when we're giving seniors choices, they should have accurate information and the data they need to make that choice. But if there's third parties out there that are providing deceptive marketing, that's not helpful.
Right.
And so they have to be called to the carpet, and there has to be oversight and stop that type of deceptive marketing.
I want to shift gears a little bit. You are also a big proponent of telehealth. This has been an issue we've been talking about kind of over the past year coming out of COVID. I'm from a rural state of North Dakota. The idea that you can kind of have Medicare providers that aren't in your local community that can be helping you is really appealing. What do you hear from your constituents about the need for telehealth? What more maybe can be done to try to incentivize that?
Right. So let me say, I think telehealth medicine, and I'm a big fan of it, fought for it to not only to have it even pre-pandemic, but to extend it since. Here's why. There are 2 urban areas said in Nevada, the rest are pretty much rural frontier. Telehealth works in both. What I know in my my rural areas, if you're in Elko, Nevada, it's 400 miles for somebody to access at times a healthcare professional. In our rural and frontier communities, there's not a lot of healthcare professionals working there. There's not a lot of options. So to bring them those services so they don't have to travel from Elko to Reno or Elko to sometimes Salt Lake City, we bring telehealth and telemedicine. The new technology allows us to do that. The doctors, the providers are willing to do that. That's essential. The same is true for our urban areas. Many seniors, many others are not mobile or cannot access easily their providers, so it does make sense for us to continue to provide this type of access for seniors. And so that's why you will see a lot of my legislation, and bipartisan, by the way, this is a bipartisan support for this, is to continue to support telehealth, telemedicine, also for substance abuse, also for mental health. That's a whole other issue, but for all of the above.
Right. We are quickly coming to a close here for our portion of this conversation. John Bresnahan, one of the co-founders of Punchbowl News, wanted me to ask you about the sphere to end this conversation, but I said, no, John, we need to talk 24. So I know, but it would be a lot more fun to talk about that probably. But I do want to ask you a question about President Joe Biden's unpopularity, how that's playing out in Nevada, and do you think it's going to have any impact with your fellow Democrat, Senate Jackie Rosen's reelection?
Well, here's what I know. Nevada, as I've said, is beautifully diverse. It is a majority minority state. If you can come into Nevada and you can talk to voters and listen to them and talk about what you are doing on their behalf and what you still want to do, you're going to be very successful. I know that just from my most recent reelection, but I also know Nevada voters, and that's what they expect. They expect to hear from you. They want to know that you understand the challenges that they're facing, that not only are you working on them, that you will continue to work to address those issues.
Yeah. Do you expect to campaign with your colleague and also with the president?
Well, I will tell you, I am always available in my state to help out anyone who wants to come in and learn about Nevada and introduce them to Nevadans. I think it's important. And I would
like to welcome Sohini Gupta, as well as Chairman Brady, to the stage for our fireside chat. Welcome. All right, well, we have a lot to unpack there from what the senator was talking about, the health insurance industry, Medicare Advantage. But I want to start with some new research that just came out. Sohini, I want to go to you, kind of give us, for those that maybe haven't seen the paper or the kind of one-pager on it, what were the top lines and the things that are most important to keep in mind when it comes to the results of kind of the impact of finances of Medicare Advantage?
Yeah, absolutely. Thank you, Anna. It's good to be here. 32 million Americans are on Medicare Advantage. And what that means is, for the first time, you're seeing more people choose Medicare Advantage over original Medicare.
Yeah.
And so they're doing this.
Why don't we do this? Why don't you tackle that one? I think they're trying to turn you up there.
Okay, they're doing this because they're getting more services, better access, and more quality outcomes. And so we're very excited about that. But we're also able to do this while saving money. You know, we heard Senator Cortez Masto talk about the importance of preserving the trust fund and extending its solvency. It's supposed to right now expire and run out of funds 2031, which is kind of daunting. We have a new study that came out from Avalier that indicates if Medicare, original Medicare used the same practices as Medicare Advantage, we would extend the trust fund 17 more years. So to 2048, which sounds a lot better. And so we are able to save money. And you know, utilization doesn't always equal better outcomes. You can do more and save money. So when you layer on top of that study that shows that we extend the trust fund, a new study that Harvard and Olean sent out that talks about quality, Medicare Advantage also has higher quality than original Medicare. So we're doing it better for less.
All right, Chairman Brady, what are your reactions to the findings? What was your kind of big takeaway?
Yeah, so serving on the Ways and Means Committee, we established Medicare Advantage 2003, and our belief was, like today, people recognize personalized medicine is really the future of medicine. Back then, our thinking was, if we allowed seniors to sort of personalize their Medicare, choosing the plans that were right for them, tailored to them, giving them those extra wellness, preventative, you know, eyes and ears and dental help, coordinating that care, because Medicare is so complicated.
Yeah.
I mean, it just is. And then giving them an out-of-pocket cap so there's peace of mind to that. We believe if we did that, we could keep them healthier. They would spend less time in hospitals, in nursing homes, more days living their life. And that's exactly what's happened, which is why I think over time, bipartisan support, it was us, Republicans, that created this initially. But as it's proven itself out, a lot of seniors are choosing it. A lot of seniors of color are choosing it. And it's really grown, I think, into stronger bipartisan support. I just want to say, there are no Republicans seeking to end Medicare. Just the opposite. We need those two choices. And right now, you'll see Republicans sounding the alarm for 2031. At the end of the day, let me just tell you, no one party is going to save Medicare. It's going to take both. It is a big, huge, complicated lift. It's going to take both parties, and we need to start sooner rather than later.
Well, talk about that. You were chairman of the tax writing panel. Obviously, this was in your purview. What impact do you think when it comes to American taxpayers? Does Medicare Advantage have? Does kind of the whole Medicare system have? Project forward, what would your advice be to your colleagues that are going to have to take on this massive problem?
Yeah, so I think, so set the goal. So I think 2031 is not just about extending Medicare. It's about improving it. I think simplifying it. We have an opportunity. Anyone who is on Medicare has got those families. Man, it is A and B and C and supplemental and D, and it can be overwhelming. So it's an opportunity perhaps to look at sort of a unified Medicare approach, may be an area, but there's an opportunity. I think the study we see here is there are parts of the Medicare Advantage model that could keep people out of the most expensive care, really avoid the really low value care, which oftentimes you spend that money without really an outcome for that patient. So there's parts of this model that I think Congress ought to be looking at as a way to improve, strengthen, but extend that solvency.
So I want to go to you. You mentioned at the top, more than 30 million Americans take advantage of the program. We heard from the senator talking about how different areas, sometimes Medicare Advantage is the program that is best suited, sometimes it's not. Can you talk about the impact that it has on different communities and where you're seeing some of the growth of the program?
Yeah, sure, absolutely. Medicare Advantage is in growth across the platform. I mean, it's not just healthy or unhealthy people that choose it, but I will say that the program is designed and popular among minorities that tend to be underserved. You've got 40% of individuals that come from incomes less than $25,000 a year. You have 37 that are above the age of 70. So as people are getting older, they're understanding that they need that coordinated care in those high-touch environments. You, and additionally, have more women on Medicare Advantage than men. So we are seeing, a diverse group, and that's why the quality outcomes are so exciting too, because it's not as if, we are just dealing with, a very healthy population. We're putting in the investments, and, as the chairman said, we have supplemental benefits, which are supports. They create a whole health environment, right? We make sure people can get to the doctor through transportation benefits, make sure they're taking food, because sometimes you need food with medicine, and your well-being and your health is all interconnected. So we invest in the human, and as a result, we're seeing that we're making them healthier.
Mr. Brady, I want to talk to you about, you're from Texas, obviously. He's been spending some more time there, north of Houston. There's a lot of rural areas in Texas. We heard the senator talk about kind of the mix of kind of counties in Nevada as well. How do you see the impact of telehealth as well as these programs on kind of more rural communities?
Yeah, so, I think one of the silver linings of the COVID pandemic was just an acceleration of telehealth, and including finally the chance for bringing mental health, across. We don't have a mental health system, as you know.
Right.
This is an opportunity for us. And so, I think seniors are picking this up and being more comfortable sooner. I think that was really a great part of this whole effort. The key, I think, is not to slide backward. Washington likes to kind of reimpose the same roadblocks to that type of innovation. Really important that we drive that forward. And Congress has some of those issues. I think, again, bipartisan. We know it works. There's some good things we can do. We, them, being them, can do going forward. So yeah, I see a bright future there, and a lot more pickup among, including veterans, in mental health issues. And yeah, it's exciting.
All right. Time goes fast when you're up here. I could talk for a lot longer about this, but I do want to give both of you the opportunity to answer this last question, which is, we have a lot of folks here on the live stream, staffers, members, constituents, advocates. What's the top thing you hope they take away from listening to the conversation with the senator, as well as this fireside chat, when it comes to the future of health insurance? So, maybe we'll start with you.
Yeah, absolutely. So I know I've kind of mentioned the quality piece a lot here. So I just want to address a little bit about the cost equation, right? We talked about the trust fund side, but if you do an apples to apples comparison, the data will show that original Medicare actually costs 9% more than Medicare Advantage. There's a lot of information circulating out there, how you slice and splice the data. We all always, the numbers, it matters. But I think we need to really take a hard look at the assessment that we're making and really dive deep and take the time to know that Medicare Advantage is saving money, and it does not cost more than original Medicare.
All right, you get the last word.
I think it is. Medicare Advantage keeps seniors healthy, and parts of that model, the wellness, the prevention, and coordination, can help Medicare survive longer and be that really important program we count on.
Okay, one last question, because I'm not getting quite the hook yet, but I want to ask you, Chairman. We talked about 2024. This is going to be a big issue. This is always a big issue when it comes to the election. How do you think this plays out in terms of seniors and kind of on the campaign trail?
I think Republicans had a big impact, I believe, both in creating by ourselves the Medicare prescription drug program, which is life-saving, Medicare Advantage, which is really, I think, up the game for choices there. Republicans, are proud to run on the record. We know the challenges of rural health care, and we've combined with Democrats on working on underserved populations in those cities. So I think we've got a strong record on Medicare and seniors, but I think we are being honest about we've got to find a way to start working on this now. That we can't wait till 10 minutes to midnight, on Medicare. And the sooner we have that conversation with our communities, I think the better we'll be able to get to that point.
Sounds like this is going to be a conversation that we are going to be having going forward into 2024 and beyond as they think about the solvency of the program in general. I want to thank both of you so much for joining me this morning. A big thank you to Senator Cortez Masto and her team for joining us, and for all of you for joining us in person and on the live stream, and to AHIP for partnering with us and making this conversation possible. I hope you have a great day, stay safe, and a happy Thanksgiving.
Thanksgiving. Great. Thanks.
Thank you. It was great. Thanks so much.